Have you ever played video games or known someone who has? You do stuff, you get experience, then you level up and you get more powers. What if charting in medicine were similar? There's different levels from novice to amateur to professional to master. A person at each level faces the same charting, but has different thoughts, beliefs, and stories that they tell themselves. It's not so hard. I don't have enough time. I have to bring all this work home. Regardless of whether you like video games, what if I told you that there was a program to take you from where you are toward being that charting master? I want you to know there is hope. Charting Mastery is my 6-week coaching program to help you master charting. It's for physicians who want to feel confident in their charting, ditch the overwhelm, and leave work at work. The first cohort will start later this summer 2022. So if you want to know when doors open for this or subsequent cohorts, join the waitlist today. You can find that at chartingmastery.net. And now for the rest of today's episode. Welcome to the MedEdWell podcast, empowering physicians to get work done at work and then be able to reflect and choose what is important for both their life and medical practice. I'm your host, Dr. Ryan Stejink, general pediatrician and life coach for physicians. Welcome back to another episode of the MedEdWell podcast, where we help you as a busy physician take your next step in wellness. I'm so excited to have another guest on the show today, Dr. Emeka Obidi, pediatrician that's been practicing for over 17 years in Western Maryland, where he also lives with his wife and their 3 kids. He's the founder and CEO of Partners in Pediatrics and Family Health, a family medical practice, where he leads a team of 4 medical providers caring for both pediatric and adult patients. His passion is all things pediatrics, and especially working with moms and their newborns. He has cared for well over 1,000 newborns over the course of his career. He is also the CEO of Newborn Prep Academy, where he runs an online course called the Newborn Preparation Course that guides new, expectant, and recently delivered moms to understand how to care for their newborn baby and what to expect so they can feel confident and empowered as first-time moms and ultimately enjoy their babies. Welcome to the show, Dr. Obidi.
Well, thank you very much, Dr. Cedric. I really appreciate the invites. I'm looking forward to our time together.
Wonderful. So tell me a little bit about your story, how you got into medicine and pediatrics specifically.
Oh boy. So I went to med school in Nigeria, which is where I'm originally from. And I actually wanted to be an ophthalmologist in med school. And with medical school in Nigeria, after you're done with your basic training, you do 1 year, an internship year where you get to do 3 months in the 4 major specialties. So you're doing 3 months in OBGYN and 3 months in pediatrics and 3 in internal medicine and surgery. And I just fell in love with pediatrics. My pediatric rotation it wasn't what I expected it was going to be. I fell in love with the kids. It was just a magical experience. And I just knew afterwards that that was what I was going to do. And so came over to the US and did a residency in pediatrics and out in New York, and came out to Western Maryland to practice about 17 years ago. And I've been at this practice for 17 years and bought it like 8 years ago, going on 8 years, and I've run the practice since then.
Great. So it sounds like you've had a lot of diverse experiences and just opportunities to really lean into what sounds like has been a really fulfilling career so far.
Yes, it has been. It's been a ride for sure, but it's been quite an interesting growth journey. And I'm glad for where I am.
So you mentioned it's been a growth journey. Have there been certain things that were particularly challenging along the way, especially with your wellness?
Yes, for sure. I think especially after I took over a practice. As you well know, that is the one area of medical training that is sorely lacking. And I took over a practice that was thriving. It was, busy from day one. It was a busy practice, and I've grown it to about twice of what it was in terms of size and revenue. And so that has been quite a challenge. I think after a few years of running the practice, I just realized, okay, this is a lot of work. And it was a good practice, but the culture wasn't in line with my own personality and true to me. So there was a lot of work with trying to work on the culture of the practice to be more true to who I am and how I show up as a person. So, but that process also means that there were lots of long hours, lots of balancing, caring for a family with 3 kids, and a wife. And so it's been quite the journey learning to set boundaries and learning to even what wellness is all about.
Mm-hmm.
Yeah. And it's been, but I'm grateful for the journey. I've learned quite a bit about myself and just how to show up better in the world.
Yeah. So you mentioned having certain values and intentionality. How has that really helped you with the increased workload of now being owner of the practice?
Yeah, I think I value family. I value being able to pour into my kids and my wife. And that definitely was a challenge earlier on building the practice. It still is, it's always going to be something you try and juggle. And I've had to get to a place where I realized that, okay, I have to learn how to create boundaries where I'm able to work on my practice and care for my patients and do what's necessary to grow the practice, but also start to realize and figure out how to better be supportive also at home and with my kids and with my wife, and just be a better husband and father. And it's a journey, but I think I'm making some progress, hopefully. But it's been, and I think much earlier in my career also, even just the term self-care was just felt it was very, for lack of a better way of putting it, very frou-frou and very like nothing substantial or something. And even when I heard that term, I would probably just think of spa days and massages, right? But more recently have come to really understand that there's way more to self-care than that. It's really being able to care for yourself, literally self-care, care for yourself. And that could be anything from just eating better to resting better to having more boundaries that are healthier, where you're able to keep work at work and, focus on your family when you need to. Yeah. And that's been helpful. Has been helpful to be able to step back and be more present. I think just be more present also, enjoy the moment. And that's something that I've definitely learned a little bit more of in more recent years.
Mm. Yeah, those are really, really insightful things you just mentioned. I mean, talking about boundaries and intentionality and figuring out what are those essential things that I need to get done to move forward in your clinical practice as a family man and a husband and a father. But then, yeah, it's like, how do you decide, okay, what do I delegate and what maybe needs to get pushed off till later? I think that's really helpful just to prompt all of us to think about, okay, what am I here to do? What are my values? What do I see my impact being down the line? But at the same time, okay, how do I be present with that family, with that mom, with that newborn who's maybe really struggling? And even with the stresses you have, okay, how do you set that aside for a moment and really lean into that? And maybe even that helps along your journey, just being there and experiencing that moment with them.
Yeah, that's so true. And I think that's even something just maybe even in the last, I would say 4 to 6 months, that I've leaned, maybe even more recently, leaned into just being more present. Even in the practice, I had to get to a place where I was terrible with my chart closure. It was just something I just dreaded because it was just so much extra work and just such mental energy. But really focused on it this year, learning how to be present when I'm in the room with the patient and cut out all the noise and really lean in, and also finish the documentation of the visit also in real time. And that has been such a gift because it's allowed me to, when I'm in the room, be truly present because I'm not worrying about all the other things I have to do after I step out of the room. And I think I've even just enjoyed practicing better in the last several months, just being more present. And I think in some ways that's also self-care, just recognizing that this is where you bring the highest value as a clinician in that moment. You're there to care for that family, and being able to give up yourself because you've cared for yourself, I think has been just a nice experience for me.
That's really helpful. I've had similar journey in terms of previously bringing charts home, having to log in on my off days. But yeah,
yes,
figuring out, okay, how can you build that connection even fairly quickly? But if you are intentional in that, and depending on how the room is set up, sometimes having a computer where you can actually face the patient and still type, it really, if you're able to work through that mentally of, okay, I can do this and I'm going to try and get everything down and be able to get most, if not all of the charting done, then it really does decrease that cognitive load of, okay, which patient was this on and which was that on? And then at the end of the day, when it's like, yeah, it takes a lot of emotional energy to be with people in their time of need. How do you then go and say, oh, I need to do another hour or 2 hours of charting? It just sometimes seems like a mountain that you can't climb right then.
Yes. I totally relate for sure. And something else that I think that was really helpful, and I had taken a course that was very helpful, earlier on this year, just learning how to chart better. And one of the things that was most helpful was being able to delve into the mindset behind the issue of not closing your charts on time, and recognizing that, there's just a lot of people pleasing. I think a lot as doctors, that's something that we probably lean heavily towards. And so it literally will probably only take 1 or 2 minutes to finish that chart, but you're worried about the next patient in the next room. And so that time that could have been used to finish that chart, you're like, there's so much. And for me, it was almost like an itch to like, no, I can't, I just have to go and see the next patient and I'll deal with this chart later on, right? But in some ways, I was robbing the next family of my, as well, because I step into that room and I'm thinking of 1,000 other things, on my mind, and things I have to try and remember to finish in the chart previously or the charts previously. And so you end up not even giving your best in that situation. I think I just had to learn, again, just that mindset behind why it was happening in the first place. And I think it was helpful. And it goes back to self-care also and boundaries, because part of it was setting boundaries and saying, no, I need to finish this chart right now. This is the patient in front of me and I need to care for them and finish caring for them, including sending their prescriptions, and then move on to the next patient who is also happy when you come in and you're fully present also. And yeah, so it's been really helpful for sure.
Yeah. And I think calling out like the communication piece of that, of saying, hey, I appreciate that you are here with me now, and I want to be fully present with you. Yes, I might be running behind, but I'm going to give my full attention to you. And sometimes when I'm able to get my charts done in real time, then I will go to the next room directly. Previously, I would go back to the workroom, but then I'd have to log in there, and then someone might come up with a non-urgent thing that could be batched at the end. Or if it was something urgent, they were going to come find me in the room anyways and say, oh, can you step out for a moment? So I think putting all those things together, being present, intentionality, communication, and the charting piece, because I think that's really what contributes to a lot of burnout for many physicians.
Yeah, that's true. I agree with you. Like I said, I think I've even enjoyed practicing better in the last several months that I've gotten now under control. So I totally agree that is a big contributor to physician burnout. And I probably would have been headed that way very shortly if I hadn't taken care of the issue. Yeah.
So you mentioned getting into entrepreneurship, and how did you work through that in your mind of, hey, this isn't what's in the type of practice that's in line with my values, and deciding to stay and to purchase that?
Like I said, it was a good practice. I practiced here for 10 years before I purchased it. And I think, when you're employed to some degree, and honestly, maybe this goes back to maybe not owning your voice much earlier. So, or I should say, not owning my voice much earlier. Even when I saw some things that I felt I wouldn't want in my own practice, I just felt, well, I'm employed. It's not my practice, and it's not like it's the end of the world. But when I eventually owned the practice and had full ownership, I realized I had to change things, and that was challenging because it involved letting people go. There was a long, messy middle of not learning how to hire well. So you're hiring based on your values, and it took a while to learn how to hire properly. And also letting go of people that weren't in line with your values and letting them go of them earlier, because in some ways it's a disservice to them to also hang on to them longer. And they're miserable, you're miserable, doesn't end up working out very well. So it's just taken a while to learn all of that. And I will say one thing that has been really helpful for me in my own personal journey with entrepreneurship has been coaching. I think it's made a big difference. Just having an independent person that is able to, give you some objective feedback. A good coach doesn't tell you what to do. They're just able to reflect back to you what's happening, gives you an opportunity to step back and look at it through someone else's eyes, see things more objectively. And typically, you know what the right decision is. And so that's been super helpful in my entrepreneurial journey, just being able to, there's no point suffering through something if someone has gone ahead and is able to point out the pitfalls and able to give some guidance. And yeah, it's just been very helpful.
That's really helpful. And I think it's important to see that you already had many of these ideas, these thoughts within you, but by having that outside perspective, you were able to step back and kind of evaluate, okay, no, where do I really want to take this? Where do I want to take this team culture building? And yeah, that means some people, it may be doing them a service to say, hey, I think you would be a better fit somewhere else. What have been some of the joys or surprising things that maybe were positive about building culture?
I think, and honestly, in the last several years, the culture has been really so much closer to what I want in my practice. And of course, just like with every family, things aren't 100% perfect every time, but it's light years from where it was. And I think just the joy of working with people that you enjoy working with, and especially for the culture that I actively work on here, it's being able to have a practice where there's collaboration, where people genuinely want to see each other succeed. And that has been just super helpful. And I have a great practice manager in my wife who helps run the practice. And it's just been wonderful for us to be able to build a practice that we are proud of, and a practice where we walk alongside people that we're happy to walk alongside with. I have 4 amazing family practice providers that I just love working with, and all the support staff. So it's been a joy. I think you're just more, and I say this all the time, to the team, that we want a place where we're happy to come to work. I think pediatrics in general is stressful, not just in the sense that it's usually high volume and just, screaming kids and upset parents, because the kids are, sick. And so having a practice where there's no extra drama or more like that's to a minimum, I think is so helpful because you can come in and just do the work you need to do and not get bogged down in all kinds of staffing drama. And of course, there's going to be some here and there, but I think compared to some what I see obtaining in a lot of places, I think we do a pretty decent job of creating the right atmosphere here. And that's been helpful. Yeah.
How would you encourage someone who's still employed and trying to build up their staff and their team, or maybe even support someone who's running the practice?
Yeah. I think another business coach has coined the term intrapreneur, and that I think has been really interesting because really every physician should be an entrepreneur, even if you don't own your practice, even if you're working at another practice, being able to build your personal brand, which ends up being a win-win situation because you get to win because you have a brand that means something and that brings value. And your employer gets to win because you're able to contribute positively to the practice. I think it's just where we should head as a physician community. Entrepreneurship shouldn't be something that's foreign to us as a physician body. I think when you're employed somewhere, if I could talk to my, what will it be now? Maybe 10-year younger self, when I was still employed, I would have just spoken up more and articulated the value because I brought great value to the practice, it's why I was here long enough for him to sell the practice to me when he retired. But I would have been able to articulate that value better and really work to influence the culture itself as well. I think that oftentimes as physicians, we give up our voice and give away our power to everyone else around us and don't realize how much power we have and not to be obnoxiously disruptive, but I think there's much good we can bring to wherever we find ourselves. I'll give you a story. For instance, I just finished a stint as the pediatric chair at the local hospital. And for as long as I have been in the community, which, is about 17 years now, we have been fighting to have a pediatric hospitalist service at the local hospital because they've had an adult hospitalist service for a while. But pediatricians were still having to admit their patients there and see newborns. And we loved a lot of it, but we also recognized that it was becoming more and more disruptive to our practices. And it was difficult to hire new talent because they didn't want to do hospital work because if they did, they would have gone to do a hospitalist program, right? So, and then you have all these pediatricians who are further and further away removed from practice, from residency, and weren't necessarily interested in hospitalist work. So anyway, long story short, we've been fighting for it for years and haven't gotten anywhere. And the administration just always gave some excuse or the other. When I became Pete's chair, I advocated so strongly for it. And we also had a good CEO who had just come in who was, willing to listen. But I don't think we would have gone as far as we did if I hadn't gotten to a place where I was able to confidently express my voice and my views and advocate. So I strongly spoke about it at every meeting we had, every executive meeting we had, and every private meeting I had with him, and really tried to articulate the value of having a hospitalist program, pediatric hospitalist program, because it was going to serve our pediatric population better. We're losing business also to surrounding hospitals because, pediatricians didn't want to admit anything that was too complicated because they're just not comfortable doing so. But long story short, they made great strides and started to negotiate with other groups. And while I was still Pete's chair, and shortly after I left after 2 years, a few months after, they signed a group to come in and provide hospitalist care, at the hospital here. And, that would not have happened if I had not grown to a place where I was confident expressing my views and advocating for what I believed in and bringing value, right, to whatever situation I found myself in. So it's really important for us as a physician community to be able to stand up and to stand for what's right and advocate for the things that we want.
It's so amazing. Thanks for sharing that story. And I think as physicians, it's so easy to let imposter syndrome hold us back from owning our voice and from leaning into how we're uniquely wired and say, okay, I'm passionate about this, or I'm passionate about that. And it's about finding who are the stakeholders, what maybe data points do you need to bring to those discussions, but then how do you stay on message and say, this is really important that we make this happen. And with all of us physicians, we can really make a difference if we do own our voice.
That's so true. I totally agree with that, 100%.
So you went from being employed to practice owner, entrepreneur, still practicing, and now you have this newborn preparation course. Tell me more about how you decided to start another venture.
Sure. I mean, like I said, I love all things pediatrics, but I especially love caring for newborns and especially first-time moms. There's just something about seeing them come into the room anxious and worried and concerned and leaving, with a little bit more of that off their shoulders and just more calm and more confident and being able to answer the questions. And I guess similar to how I got into pediatrics in the first place, where I did my rotation and just fell in love with pediatrics. I think I just began to lean a little bit more into that special interest and started to think about how else can I serve and create greater impact beyond, my practice and the few patients I can see. And in the last, 6-9 months or so, started to develop this program, which I'm just super happy about to bring to the world. And some my way of in a little bit contributing to just a better experience for moms, and it's geared towards new moms especially, but certainly any mom who is worried, overwhelmed, not sure what to expect with her newborn, or a mom who's just recently delivered and, is overwhelmed and has 1,001 questions. And the program, comes along and helps them understand what to expect from their newborns and how to care for them safely, and so they can just be more confident and enjoy their babies a little better. I think over the years, I've just seen that there's so many things that moms worry about that, as a pediatrician yourself, that wasn't even anything serious, right? And of course, there are times where they're worrying about something that is serious. And I've learned over the years to really listen very carefully to a mom because she's with this child all day long. And just to make sure I'm not missing something when she's worried about something she's seen. But also just recognizing there's so many things they worry about that if they were just armed with this information ahead of time, would have just reduced the amount of anxiety they had. Because oftentimes they're having to wait at least 24 hours or several days or weeks before they bring this up with their pediatrician, right? And that was like all that time they had to waste worrying about something that wasn't such a big issue. And so that was just my passion, is to be able to create a course where these things are sort of brought up ahead of time, sort of like anticipatory guidance, so that they're just better prepared for the experience. It's not going to make it perfect. It's still going to be hard work caring for a newborn. But if I can, do something to reduce that anxiety and worry, I think it's hopefully well worth it.
Well, it sounds like an opportunity to use some of your creative passions and patient care and really multiply your impact. So I'm encouraged to hear that and want to go check that out. Encourage everybody else to check that out if they've got kids in their family or work with children in medicine as well. Thinking about adding this new thing, sure, it's a passion of yours. What things did you have to do around mindset processes to make this something new that you were adding still fit within your other responsibilities? Did you have to delegate something? How did you deal with that from a process standpoint, but also your mindset?
Yeah, that's such an important question and really a great question. I think so. Mindset number one is really realizing that, first of all, I can do hard things. that, yes, it might be hard to be able to juggle all these things, but I can do hard things. I actually ran a half marathon last year, which was just the highlight of my year.
Wow.
And one of the reasons for training for and running the half marathon was to prove to myself that I can do hard things. And so it really was quite the experience for me. And so, I brought that mindset into this new venture saying, I can do hard things. I know this is going to be difficult, in some ways, but I can handle it. I would just have to be able to look at my workload, realize what needs to be reorganized. I have a personal assistant that's been really helpful, and a VA team that helps as well, a virtual assistant team that helps with some of the work. Just learning to delegate a little bit better and freeing up myself to be able to bring the highest value I can to the practice itself and doing the things that I only can do or should be doing, and starting to let go of things that, yes, I can do them or I can struggle through them, but there's an opportunity cost to struggling through something that you don't have to do. And yes, you may have to pay a bit more money to have somebody else do it, but that frees you up to be able to pour yourself into things that only you can do or only you should be doing. Whether that's really working hard to create the culture here at the practice, or pouring myself into the creative process of bringing together a new online course. Yeah, I think it's just been delegation, realizing that, yes, this is going to be difficult, but I can do it. So, no big deal. And then just having a really wonderful, supportive wife that has been able to help me create some space for me to do that as well. Certainly has been super helpful to have her support.
Wonderful. As we wrap up, if there was one piece of advice that you would give to a physician earlier in their career, or something you might have told yourself 10, 15 years ago, what would that be in terms of how you create this balance and care for yourself?
I would say that don't minimize the impact you're able to create in your world, your immediate world and the world around you. I think that it's easy to say, I'm just a physician, I'm just, a doctor, I just have this, job. But there's so much value that you bring to your world and your community, that your training itself prepares you for so much. I think because we're in it, we don't realize how valuable our training has been to be able to stick with something for a long period of time, to be able to work with a team. Medicine is a team sport at every stage of the game. There's hardly any physician who practices solely alone, right? And those are all skills that you can bring in. And I think just encouraging them to recognize their value, own their voice very early on in the process, in a very respectful and very collaborative way, but being able to stand up and speak up when you need to. And, prioritizing yourself to be able to create the right atmosphere around you, even for your family. I think, it can be easy to get wrapped up in our patients and the workload and all of that, and get so burnt out that we bring a lesser form of ourselves back home to our families, which, it's they don't deserve.
Thanks so much. That's amazing advice. And I think an inspiration to say, how do we each take that next step in caring for ourselves, our families, our patients, and colleagues and staff. So thanks so much, Dr. Obidi, for joining me here on the MedEdWell podcast.
Oh, thank you very much, as I said, because it was really a wonderful pleasure spending some time with you, and I really appreciate it.
Well, thanks so much. If you'd like to connect with Dr. Obidi on social media, he's on Instagram and Facebook. And for those of you interested in checking out his newborn preparation course, those links will all be in the show notes. I want to encourage each of you listening to share this episode with another physician. I want to encourage you to subscribe to the podcast and take your next step today. Thanks so much for all you do, and have a great day. And now for our important disclaimer. Dr. Ryan Stedjink is a practicing general pediatrician, but the MedEdWell podcast does not reflect the views, opinions, or belief of his employer nor his affiliated university. Additionally, the MedEdWell podcast is for educational and entertainment purposes only and should not be considered advice regarding financial, legal, student loan, medical, or any other specific topic. In such a case, you should seek consultation with a certified professional in that particular area. Again, thanks for joining us on the MedEdWell podcast, and have a great day.